Now I would like to give the floor to the third lecturer, Dr. Kleanthis Manolakis, which is coming from Thessaloniki, Greece. His lecture is going to be for surgical implant placement in the virtual reality environment, introducing a new training model. Dr. Manolakis, welcome.
Morning.
Good morning.
Dobro jutro.
Dobro jutro.
Thank you so much for the kind invitation. Thank you, Elena, for the kind introduction. I'm happy and delighted to be part of this truly international meeting, and I would like to thank my friend Fisnik. The surgical implant placement in a virtual reality environment. So I would like to discuss and share with you a new training model that we are developing in Greece. Our team believes that there is going to be potential in this kind of training, in this kind of treatments, because I would like to share with you some of the upcoming challenges in medical education in the future. One of the major challenges is dealing with a global shortage of healthcare workers. So according to some studies, the shortage is pervasive and the gap is increasing. So growing shortages will require the global health care workforce to double, generating a demand for 40+ million additional healthcare workers globally by 2030. There is an unmet need for upskilling and reskilling. So in the future, most healthcare workers would have to definitely upskill their performance. Another issue is about modernizing our treatment and educational standards. Similar to the flight simulator in the aviation, which is omnipresent for several decades now, the outdated training standards would impede mandates from getting adapted, getting used, and getting performance of up-to-date treatment. Restricted training time is also an additional issue, as restricted, for example, restricted operation overtime, operation theater time for residents, which practically means that less on-the-job learning with the 80-hour-week capacity, plus increased difficulties with the COVID-19, this pandemic that we are dealing with at the moment. And one additional issue, the last maybe one, important one, is related to remote training access. So there is going obviously to be a growing demand for health professionals in countries with less developed infrastructure. Remote training would be beneficial for these guys. So how about an VR training simulation for healthcare providers? What would be the advantages? It would actually facilitate the rapid acceleration of human learning in medical training using this kind of simulation. Let's have a look at some of the potential advantages. So an increased trainee engagement and knowledge retention of up to 70% can be generated after VR training compared to videos where the knowledge retention is roughly around 10% and mere lecturing where the percentage is roughly around 5%. So there is a gamification effect, which is the young generation is keen to using these modern devices, confidence in treatment protocols, unlimited mistakes, which are for free, and embodied cognition support this treatment outcome. Another advantage is the decreased training time, which means that less than 29%, almost 29% less training time skill transfer from VR to OR. So experience gained from VR can faster be applied into the OR. Some numbers from the market analysis commissioned by Orama VR to Borgstrom and Cambi Consulting concerning the US and global needs highlight the decreased training costs in modern dental and medical education. For example, roughly $300,000 per year in OR time costs can be reduced, and the cost of cadaver stations is up to 1 million per year. So we can drastically reduce these costs. Essentially, we generate some values in terms of training healthcare professionals, which is a transfer of skills and embodied cognition in a fail-safe environment, which is, I think, the most important aspect. Additionally, we have a scalable training with low cost and on-demand VR software on any VR hardware, so we are not bound to a specific VR hardware. The progress that is achieved through learning curricula is faster, cheaper, higher fidelity, and realism. This is a publication 2019 in the Journal of Arthroplasty, which deals with some preliminary results on virtual training simulation in a total hip arthroplasty environment, a study that was supported by NYU. And the results in the lower left part are, I think, interesting. So the VR cohort demonstrated greater improvement in all score categories, like steps, technical performance, skills, efficacy, and flow. And after 2 trials, VR trials, the measured improvement in all categories was just around 8% in just 2 trials. So imagine if we would have the possibility to do more trials. Our goal is to focus more on the dental training using the VIRED. The VIRED is a specific tool for dental education, where we would like to apply modern technologies, modern tools. Now, VR, virtual reality, is an artificial environment that is created by software, and it resembles the real world or is completely different from the real world. It's definitely an artificial environment for training purposes. The term virtual, first used in the computer sciences in the 60s, is defined as not physically existing, but made to appear by software. It's an immersive environment where we have no, it doesn't resemble at all a physical appearance, but it is immersive, which means that it is an ideal environment for training. The VR technology has been widely employed in areas such as medicine, engineering, entertainment, tourism, education, and military. So VR applications exist in the market for over 10 or 15 years already. Actually, what we need in order to be immersed in this VR environment is the headsets consisting of head-mounted display and the controllers that we can facilitate and train various hand movements. So basic points of VIRED is that it embodies an intelligent cutting-edge technology, so immersive experience and acceleration of dental surgical training, plus real-life scenarios that are constantly created and updated, enhancing and optimizing dental training. So it's not focused on dental training. The tool is addressed to dental students and graduates, as well as experienced dental practitioners who are willing to acquire new skills. So the idea is that this technique, this tool, can be applied at universities, dental schools, private dental practices, manufacturing companies, all parts of developing new skills and protocols in modern dentistry. New cases can be developed upon request. And of course, we can promote novel dental procedures, products, and supplements. For example, what Dr. already beautifully described before in crafting procedures, this is one of our next topics to develop in terms of training in a VR environment. As discussed before, according to this study by Hopper, the VR simulation provides a retention rate of roughly 70% compared to 5 or 10% respectively using video or lecture. So it's much more effective in terms of retention rates of the acquired knowledge. We get a high learning effectiveness, reduced training time, and reduced mistakes in surgeons, which actually is more important in critical mistakes. So we are monitoring critical mistakes. Some of the advantages are a hands-on learning experience without setting your foot into dental surgery office, minimization of severe surgical errors and mishandlings, and optimization of time and funds. Additionally, we get access to advanced scientific data, tutoring 24/7, absolutely, and tracking one's errors and running individualized performance statistics. So, for example, I was trained several times in the guided implant placement protocol that I would like to share with you later. And my personal statistics are monitored by the computer, so I know my improvements over time and in my performance. Some additional advantages are the ability to analyze every step, rewind, so repeat same clinical procedures until mastering is achieved, timing, and the multi-users environment. With this specific platform, up to 7 users can be simultaneously connected and can interact on the same platform. So after doing some preliminary presentations 2018 with Chinese colleagues in Beijing and presenting the VR simulation in Istanbul last year in Turkey, where we also met with Dr. Kasapi, I would like to share with you an animation of the existing platform that we have developed over the last few months. The topic is an animated guided implant placement, and this is the state of the art that we can achieve today in the VR environment. So this is an animation of what can be trained the state-of-the-art graphics are, I think, very efficient. So our topic is to train the drilling of 4 implants in the lower arterial zone. We would start with a 2mm drill. Next would be the 3mm drill. Followed by the implant placement. So these are the steps that the trainee can perform today using this specific module. Final step is placing of the cover screws and suturing of the surrounding tissue. Conclusions. I would say that the virtual surgical implant placement is set to address the issues of reduced real-time theater experience of current dental training in complex, highly demanding dental implant placement procedures. Also, it provides novel treatment protocols and low-cost psychomotoric training modules. It is an affordable tool. So on top, it offers also a unique user experience. So it will improve patient, we firmly believe that it will improve patient outcomes. It will definitely reduce errors, and it will reduce also the training time.